Good afternoon, everyone. I think that's the first time I've ever said that one. Welcome back to the UBC Learning Circle. We're pleased to be joined today in Circle by Drs. Terry Alder and Kelsey Louie, as well as Atma Sigobin from the FNHA. Together, we're all going to begin a discussion on the FNHA's Virtual Doctor of the Day service, chat a little bit about the experiences that the group have had, and chat through the service a little bit more. This is part one of a two-part series, with the second part coming in towards the end of June. Before I get into anything else, I would like to acknowledge that I'm zooming in from the traditional and ancestral territories of the Comox First Nation. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So just before we jump into anything, gentle reminder here, the topics we cover can sometimes be sensitive or emotionally triggering. If that's you for today, please make sure you're looking after yourself. If at any point you feel that you need to talk to a friend, elder, counselor, or family member, don't hesitate to do so. Introductions. My name is Cole. I'm from the Chelito First Nation. I'll be facilitating this session today. Sharing our digital space, but off camera, is Cynthia, our production coordinator. If you feel so inclined, please introduce yourselves in the chat box, kind of get that conversation started. Also, if you have any questions that come up during the session, please feel free to throw them in the chat box or the Q&A function. And from there, I think we'll transition over to Dr. Aldred. Terry?
Great, thank you. And so yeah, maybe we could just quickly introduce the speakers. So my name is Terry Aldred. I'm Kath from Claston. I'm a member of Lasilia the Frog Clan on my mom's side, and on my dad's side, I'm Métis Cree and mixed European. And I'm calling in today from the Lheidli traditional territory, otherwise known as Prince George. I'm a family doc by trade. And here today in my capacity as the medical director for primary care for FNHA. So yeah, really honored to be able to share a little bit about our the FNHA Virtual Doctor of the Day program. So I'll pass it over to Kelsey to introduce yourself.
Thanks, Terry. Our Jesuit friends, Kelsey Athnan, Menofilton Athnan, Heth Klam into Chechahathech, Lekwongan, Haimuch, Asna Te Gije. So good afternoon, friends and relatives. My name's Kelsey Louie. I'm Coast Salish from the Tla'amin First Nation, just outside Paw River, and just acknowledging I'm zooming in virtually from Lekwongan territory here in Victoria, where I now live and work. I too have formal training as a family physician and have been a part of both the FNHA on the I guess public health side of things, but also with the Virtual Doctor of the Day doing clinical work. Awesome to be here with everyone today.
Hi.
There we go.
Hi, good afternoon, everyone. My name is Atma Sigobin. I am zooming in from the traditional unceded territory of the Coast Salish people, more specifically the Katzie First Nation. I'm just a few kilometers away from the community here in Pitt Meadows. I'm here in my capacity as the manager of the benefits management, which is a bit of a clunky title, but in reality, the policy manager for the health benefits program. Honored to be here. Very thankful for the opportunity to talk a little bit of the program about how we also support the Doctor of the Day program. Thanks very much.
Wonderful, thanks. If we can get the slides pulled up, that would be wonderful. So today we'll be going through a little bit of the highlights of the First Nations Doctor of the Day program. We'll share some of some promotional materials that have been set up to help share information about the program, as well as to share people's experiences thus far in the program. And then we'll go through a bit of an overview of what the service looks like and how it runs on a day-to-day basis. And Dr. Kelsey Louie will be sharing some of his experience as a physician that's been working with the program since FNHA Doctor of the Day was launched back in April 2020. And then Atma will be going through a little bit about the health benefits as well as some of the services around clinical pharmacy and others that we work with as well. I'm trying to offer a wide range of services for First Nations community members throughout BC. And then hopefully we'll have some time for questions. So next slide. So the First Nations Virtual Doctor of the Day program is a unique program that was stood up in April 2020, in part due to the pressing need that both our dual pandemics raised that resulted in lack of access that may have been more pronounced, as well as people losing access to their primary care services due to COVID, due to community closures and blockades and things like that, that were designed to help protect communities. But if health needs came up, sometimes that was really challenging to navigate. And so it was stood up within a couple of weeks. We launched on April 1st, 2020. And the intent of the program is to try to bring services closer to home, as many people were self-isolating in their communities and kind of bubbling within their families. The need for this became even more pressing. And although some parts of the province did have telehealth access, that wasn't equitable and available for all people. In addition, a lot of health centers were closed. That often was the place people would go for telehealth healthcare services. And so there was a need to bring those services actually directly into people's homes. And so the program is designed to see all First Nations people in BC, even if you're traditionally from somewhere else in Canada, and family members. And we have also been seeing Métis and Inuit people as well. So trying to be very inclusive and provide services to all Indigenous people in BC. The program includes both Indigenous and non-Indigenous physicians. However, we try to root cultural safety and humility best practices in both how we recruit physicians, but also in our ongoing learning. Next slide. And so the virtual health services overview. So we have two virtual pathways. One is the First Nations Virtual Doctor of the Day program, which is where we're going to focus our energy today. But we also have a First Nations Virtual Substance Use and Psychiatry service. Say that 5 times quickly. And that one was stood up actually in August 2020. Again, with our dual pandemics with COVID and the opioid crisis, just an overwhelming need that was already there, but made worse in the past year to help address mental health and addictions throughout BC. And so the First Nations Doctor of the Day program is run by family physicians, and it's a public facing, so that means the number is public. Anybody can call to request an appointment, and we're open 7 days a week from 8:30 to 4:30. And we do either Zoom or telephone appointments depending on connectivity. Zoom is always preferred as it can be really helpful to be able to see patients, but we can do phone calls as needed as well. And the VSUPS program is referral based. However, you can be referred by your local care team, so counselors or nurses, elders that are working in your communities, as well as by your physician. If you need a referral but aren't connected with somebody who can help facilitate that, you can also call the First Nations Doctor of the Day program and talk about your mental health and or addiction needs as well. And so psychiatry works from 10 till 3. And the substance use pathway works from 9:30 to 5:30. And they really prefer being able to use Zoom as it's really important in the work that they do. However, if absolutely necessary, they can also do phone visits. Next slide. So the purpose of the First Nations Doctor of the Day program is to improve access, timeliness, and quality of culturally safe care. And and we try our best to not disrupt services locally that are working well. And that, you know, if you don't have access or you've lost access to your primary care services, we do our best to help facilitate and reconnect to local or on the ground services as needed. Um, and you know, with the First Nations Doctor of the Day program, you know, it has been designed and led and delivered by and with First Nations. And so really this is all of our program. And so we've really seen how people accessing the services have provided a lot of feedback and really feel empowered to help us improve, but also to let us know what we're doing well. And that has been really great to see. Um, and we like the work that we do with the Doctor of the Day program is only possible because of our key partnerships with people like the Rural Coordination Center and the real-time virtual supports that are happening provincially, but also with Northern Health and others. And it really has been a very transformative service. So maybe I'll pause there, and I don't know, Kelsey, if you want to jump in.
Sure. That's a fantastic overview. Thanks for that, Terry. So as Terry alluded to, this service started up in April of 2020. Really just kind of recognizing there's a real disruption of community members, you know, whether living in community or in urban centers. I think everyone kind of found there was a disruption of healthcare services when COVID hit. It was really hard to get in to see a doctor or a nurse practitioner or your community nurse. You know, some people who relied on physicians or healthcare practitioners to travel to communities, a lot of that became disrupted. And so there was this real sort of need, and that need existed before COVID came around, where we've heard from community members, you know, issues with accessing primary care, with having it be delivered in a fashion that was relatively safe, or where community members were, I think, maybe in more control over the setting, the environment, and things that way. So this program, when it rolled out, you know, it was kind of brand new. A lot of our communities have kind of delivered virtual care or have done team-based care previously. But we broke this down into a health authority sort of model. So I was maybe one of 8 members here on Vancouver Island. And this is where as I mentioned, this is where I work, it's where I live. I have traveled quite extensively around the island, and I've been fortunate, you know, throughout my life to be able to travel to a lot of different communities around the province. But I kind of consider, you know, a lot of Vancouver Island to sort of be my backyard in a way. So having that familiarity with the geography, with the communities, with some of the major centers when it comes to the hospitals and other referral places, it, I think, provided me some insight when I'm speaking to people who are, you know, in rural, remote communities. They live in the north of the island, you know, or on over Tofino Way. Those places are pretty far from where I live personally, but I've had the chance to visit a lot of them. And having the opportunity to grow up in community and visit communities, you know, recognize some of those challenges or barriers when it comes to people's healthcare. You know, a lot of the time, people want to be able to speak to a primary care provider, and that's fantastic. But at times, you know, we need to order blood work, you know, send people for imaging, maybe do a prescription. Some of those things that occur that, you know, having a sense of the lay of the land, if you will, the geography, I can kind of appreciate, you know, for some people, where they have to go to obtain those services. And so starting, you know, early on, we really built this from sort of scratch, and it occurred in all different areas of the province. But we've so far, like, it's been very valuable, super rewarding. I've had, you know, great feedback from community members just around the ease of utilizing this service. Like I say, they're able to do it from their own environments. which I think people just kind of find maybe comfortable at times. Okay. We're able just to meet people, as Terry alluded to, where people are at. And that's been, I think, a real special thing that I've heard from our community members. Yeah, I've been really proud to be a part of this service since the early stages. And, we've had a lot of great Indigenous physicians, but also allies who work with us. And I felt, very well supported by our cohort of physicians, and it's been a really great learning journey. Being able to participate in this service and offer it to our community members, but to hear how it's landing in community, and then also how it seems to work with our leaders or those who work in community as well. We get a lot of phone calls and kind of liaising with nurses who work in the community. We get some from treatment centers, from other people who are working with our community members around, their health and wellness. And sometimes it's just sort of that collaboration piece, and we're able to do that virtually. So we're kind of moving into this new virtual world, and I think there's a big component of it that's going to stick around for the future. So we're, I think, working with communities and very receptive to try and find out, what seems to work best amongst our communities, so that they can have healthcare delivered in a very good and safe way for them. I will pass it back, and I'm not sure if that's a video next or panicking. I thought my phone was going off.
Thanks, Kelsey. So we're just going to take a couple minutes to share a video of one person's experiencing accessing the program. And so if we can play that video, that'd be great.
How I first found out about Doctor of the Day was through my mother. I was actually sick, and I was in bed, and it was probably a 2-month wait to even get a phone call. Talking virtually and online, it seemed to be a lot easier. The Doctor of the Day actually had called the hospital and arranged a lot for me as well. So they were really helpful. They went above and beyond. So it was really, really good. It made me feel really safe also. I felt like I was in a safe environment at my house too, calling, talking about my problems, and can share and express and talk about my stuff without being judged or anything like that as well. And I thought that was really good, because I've had that up at the hospital a few times, and it's really, really not a fun experience. So because I'm a very active guy and I'm really avid with outdoors and all my hobbies, like I do outrigger and canoe pulling and stuff like that, and I found that it was really hard for me just waiting for something as simple as like an iron deficiency. And they decided to order more stuff to kind of eliminate what it could be. So I thought that was really helpful. But they really investigated a lot more and asked more questions and how long things were going on. And they seemed to really care for me. And we were chatting for maybe about 45 minutes or so. So it was a good one. Yeah, it was a really, really good experience. The thing I liked best about the service is that it was so easy to use, and it was just fast, quick, and interactive, and I'm getting my results so much faster. And it seems to help out a lot more as well, because they communicate with my family doctor too. So it seems like I have a lot more care now as well, with different opinions from 2 doctors too. She reassured me that she was going to be there for me as well too, which I thought was really good. The whole process of it actually kind of just blew my mind with how quick everything has gone, and I'm just getting blood work, everything that I've needed, and it felt like I've been just dragging along and taking a long time. And yeah, I don't know, it's just a really good service. I would definitely recommend Doctor of the Day to anyone. It's just so much easier, especially if you're having issues with getting in with your family doctor or anything like that. I found that it was really, really easy. They almost did all the work for me. I just had called, and they put in almost all the work and effort for me and made it seem so much easier. And it was such an easy process, and it was hard for me to figure out, calling doctors, waiting for 45 minutes just to even get an answer saying you're going to be waiting 2 months to talk. And it was it was just such a breeze is all I can say. It was just the fact of not being so frustrated, having to call here, call there, trying to get in here or whatever. Like, it was just, it was easy. It was really good.
Thanks so much. We can move on to the next slide. Yeah, so I mean, I think some of the things that you know, the video touched on was around you know, just the difficulty with access, especially during COVID, and also sometimes the confusion that people can have with how to navigate the system, and you know, and that sort of thing. And so, being able to have the time that they could spend with the physician was really important to really understand like the whole picture. And that, you know, again, wherever possible, we do try to reconnect with people who do have family doctors, and you know, let them know what we're doing and collaborate, and remake those connections as possible. And so I think, yeah, so I think those are some of the things that the video really highlighted, and kind of speak to, you know, yeah, how the service has kind of lent in where there has been gaps. Then we had another video about featuring yours truly, Dr. Kelsey. That were we going to share this one, or we're just going to let Kelsey speak to it?
Doctor of the Day basically just means a rotating schedule for a physician who provides coverage for that day. So in this case, a Doctor of the Day will be present or on call or working that day, but it may be provided, the service may be covered by somebody different the following day. The virtual Doctor of the Day service works by the client or community member phoning a 1-800 number and connecting with a medical office assistant. That office assistant will then book an appointment with the physician and the client, either by telephone or over the computer or a laptop or tablet, to be able to connect sort of face-to-face virtually.
So I don't know how extravagant that one was, but that was early on, and I think we were just trying to communicate kind of the ease of use in how to access the service. And we mentioned like the Doctor of the Day, it is a rotating service. So as I mentioned, I'm on Vancouver Island, and we probably have 8 physicians who work for the service, you know, plus or minus a few of them. But we all have various schedules. Some of us are able to kind of stick to a relatively regular schedule. So some patients know, you know, when some of us are working, it might be every Friday, you know, some might be every Monday afternoon. And the rest of us kind of just sporadically fill in the gaps. So for the community member, they might not necessarily know who they're going to speak to that day, but we certainly just keep kind of rotating through. And like it was mentioned, we do it either over the computer, just like this, or some people feel more comfortable doing it over phone. And yeah, I think going back, Terry mentioned, you know, one of the things that we really appreciate, and I think one of the things that's been really valuable for me, is the amount of time we're able to sit down with patients. So we generally, I find most of the appointments, we have about 30 minutes for each appointment, which really allows us to cover quite a bit of ground, if that's sort of what the patient would prefer. Sometimes it's a little bit shorter, but you know, we can really kind of get into some things. And I find what it allows me as a physician is the opportunity to really sit and listen. And I think that's really important with care. And in some settings, that's challenging to do. And I think that's been some of the really good feedback, is just the appreciation that patients feel listened to, and that they have the time to explore whatever healthcare issues or questions they want to talk about. So that was just a little bit about that. And like I say, it's just sort of the ease of use of being able to call in and, let us know where you're calling from, and they'll connect you with the right doctor who's working in that area that day.
So I think we've kind of already covered a lot of this, just with sharing a bit about the program and the experience working with it. So I won't spend too much time going over, but essentially you don't need a referral. It is public facing, so patients can call in directly. Of course, if you're a service provider and like to refer somebody, you're more than welcome to. And we it's a virtually delivered culturally safe primary care program. We can provide care in as much as the virtual space will allow us as a full scope family physician services. And if you're unsure if what you have is something that can be helped virtually, I'd still recommend calling in and discussing it, because sometimes the docs can also help navigate or help connect you with on the ground resources as needed as well. And the program isn't intended to be an emergency or acute crisis situation. For the most part, we still have same day access, but it may take a couple of hours. And so if you're worried, if there's if there's something serious or life-threatening going on, then we still recommend going through your emergency services. And it's not intended to be a replacement where on-the-ground services or other successful pathways exist. And Kelsey already spoke a lot to the regional model, and so we do have 4 regions: Vancouver, Coastal, and Fraser are connected as one region, and then we have a group of docs that cover Interior, the North, and the Island. And so on any given day, we have about 4 docs working across the province, and a group of 3 MOAs. Next slide. So for cultural safety and safe spaces, and so within our vision of the FNHA primary care team, we are committed to increasing the use of culturally safe and anti-racist approaches in the design and delivery of health and wellness services. And so part of how we did that within the virtual pathways is by putting it into how we select physicians to work as part of the program, as well as building ongoing continuing medical education resources around cultural safety, and encouraging an ongoing self-reflective process. Sorry, I'm just going to close my door. My husband has a much louder voice than I do, so apologies. And then the other thing we do is, again, this is a First Nations program that was designed and led by First Nations. And so having feedback from patients and communities is really important. And so within our evaluation feedback or framework, we send out a survey with the appointment link for people to complete after their appointment to give us anonymous feedback about the service that they provided, as well as we do have a complaints and compliments pathway, both within the quality team within FNHA centrally, and then we also have a process within the primary care team on how we navigate any issues that arise. Next slide. And so the other thing that was kind of designed over time, I think for the vast majority of our connections with patients and community are very positive, but we also wanted to set a precedent that we wanted to co-create safe space. And so And so that doesn't mean just how we define safety, but also how the people accessing care define safety. And so when somebody who hasn't accessed the service before calls in, one of the things that is reviewed is our kind of our safe space framework with the patient to kind of just talk about how, what respectful engagement means, and if they have any questions or comments or things that would help them feel safer in the space, then they're able to share, and that will be shared with the doc. And then there's also a prompt for the physician to also mention it again to see if there's been any questions or comments that have emerged since they reviewed the information and details with the MOAs. And so as part of that, if there are concerns that are raised, then we have a bit of a process. And one of that processes is if there's a number of concerns around communication challenges or other things, then as a leadership team, we will meet with the client to kind of discuss and hear from them about what their experiences are, and then go through a more formal process where we kind of co-create, how we want to work together going forward to hopefully make it more safe and going forward. And so all of that is kind of reviewed with the clients up front, but we're always happy to re-engage and have those conversations on an ongoing basis as different things may change. Next slide. So the virtual pathways are held both jointly within the primary care and eHealth and urban and away from home department. Again, say that one 5 times fast, as well as with the medical affairs and wellness office, which is a new kind of office that so far just has yours truly in it. So it's not much of an office. And so as the medical director, I provide kind of clinical oversight for the virtual pathways and work closely with the physicians. And then I also collaborate with Megan Hunt, who is the executive director of the PCEU department, who kind of oversees the operational framework as well as the MOAs and care coordinators and other team members that work with our physicians. And so, yeah, it's very connected. And so our team continues to grow. We have at least 30 physicians, I would say, and at least 5 of those who are Indigenous. We're still kind of developing our process where we can be more able to accurately reflect these numbers. And we have 5 medical office assistants, 3 that are dedicated to the DoD pathway and 2 to the virtual substance use and psychiatry pathway. And, as the first point of contact for patients, having MOAs who are very culturally aware and humble and very kind has been really important. We've received a lot of positive feedback for just how well the MOAs are connecting with our community members, which is really wonderful. And I think we have a really great group of engaged physicians. It's a new program that required a lot of opening doors and navigating new pathways, and they've been incredibly patient and pioneering with us, and we definitely couldn't have the programming that we do without the docs that we have involved. Next slide. And I think I could pass it over to Atma now.
Great. Thank you, Dr. Terry. So I'll be talking a little bit about the health benefits program. So just a really quick bit of context for anybody that's not familiar. The simplest analogy I can draw for the health benefits program is group insurance, similar to what you would receive by an employer. The difference is we're fully funded through the federal government, but the plan itself is designed specifically here in BC. And that plan is available for anybody that's registered status First Nations. So going back a little bit, back in 2019, we entered into a partnership with Pacific Blue Cross for claims administration for our dental, vision, medical supplies and equipment, and some of our drug benefits. That was a big milestone for us. And one of the things that was a big win was the access to something called the PBC member profile. A tool like this is fairly commonplace for group insurance through an employer, again, as my example. But for a publicly funded plan, it's fairly unprecedented and relatively new. And what it does, it really gives full transparency and full visibility for clients into what's covered by the plan. Most of our providers do have the ability to direct bill, but in the event that in the rare event that a client needs to come out of pocket and pay for an item, they can actually submit claims electronically by their smartphone. And in some cases be reimbursed in as little as 2 business days for costs that they might have incurred. Again, fairly rare, but at least that option is available. Again, in terms of just literacy for the program and tracking the app, and that service allows individuals to see what their claims have been and if there are certain limits, how close they are to reaching those limits. And then finally, within the app, we actually received quite a bit of feedback from clients leading up to the transition to PBC. Some were fairly strong in the opinion that they wanted to keep their status cards. Others were fairly strong in the opinion that they did not want to use their status cards. So this app allows the ability to print out essentially a PBC member ID card. Your member ID is parallel to your status number, so it is still your status number, but it allows you the ability, if you choose, to present a PBC card instead of a status card. So just a little bit of choice for individuals. So just really quick introduction into the PBC member profile app, just to let folks know that it's something that's available for them to get information about the plan. If we can go to the next slide, please. So in terms of that, the health benefits program, it does actually offer benefits in 6 distinct areas. So dental, medical supplies and equipment, vision care, pharmacy or drug benefits, medical transportation in the event that individuals can't access medical care in their home community. Medical transportation will support them in getting to a location where they can receive that care, and for mental health services as well. For brevity, the program is fairly broad, but for brevity, I'm going to zoom in a little bit on our pharmacy benefit because it's usually the one most accessed by our clients. It's kind of the biggest by expenditure area, and typically the one most used through our referring physicians. So I'll zoom in a little bit on pharmacy really quick. If we can go to the next slide, please. So our tagline when it comes to the pharmacy benefit is drug benefits. We've got you covered. We have an umbrella if you get it. Really wanted to highlight here that the drug benefit is different than what we had under NIHB. Really what we wanted to do was plug into a lot of the provincial services. This had a couple benefits, right? It allows our members to go through all of the same processes that are available for all other BC residents, as opposed to going through a federal system, which was under NIHB. So that means that the process for our clients is the same as everyone else. It's not a different process where providers aren't as knowledgeable or familiar with. So it just leads to a little bit easier navigation. And that does align to a lot of the feedback we've received. So this drug benefit, again, plugs into some of those provincial services. So our clients now have full access to all of the provincial agencies, such as the Renal, BC Cancer Agency, the Center for Excellence, et cetera, and the referral processes are very much the same as they are for all of the British Columbians. Again, being a provincial plan, the drug clients under the drug benefit now also have access to all other pharmacare programs, and specifically Plan W, which is the plan designed specifically for BC First Nations. And then through the special authority process, there's access to another set of drugs that are not specifically under Plan W, but are access to special authority. And then finally, through a residual formulary, which FNHA has developed again through that partnership with Pacific Blue Cross. And that partnership with Pacific Blue Cross, so that residual formulary that I'm referring to, does give us a certain degree of flexibility to do things that might differ slightly from some of the provincial structures. So a good example of that is our coverage for the Shingrix vaccine. That's not something that is funded through the provincial systems, but through our partnership with Pacific Blue Cross, we're able to offer that coverage and still have it be a direct billing service so that clients don't have to pay anything out of pocket. So this is a really high level overview of the drug plan. If there are specific questions about drug coverages, by all means, there is the the PharmaCare formulary search, but also through our assessors, our customer service line, which can be reached at 855-550-5454, where our assessors can answer any questions about drug coverage and sometimes offer some suggestions on navigation. We can go to the next slide, please. So again, at a really high level, in terms of the intention on how you would access the pharmacy benefit, I mean, it's a parallel process for any of our other benefits, kind of similar to the MSNE or dental, for example, except you would obviously go see a dentist if it's a dental coverage concern. But generally speaking, to access the drug program, you would need to get a prescription from a prescriber, for example, doctor of the day. You would then, if that particular prescription required a special authority, the prescriber would have the ability to submit that request directly to PharmaCare. If one's not required, you can either physically take the prescription over, or it can be transferred over to your, the pharmacy that you usually pick up your medications at. And our plan is quite robust in that it would fully cover a wide variety of chemicals for any number of conditions. One of the things that we always tell clients is if you're accessing the Plan W plan and you're being asked to pay anything out of pocket, please give us a call at that 855 number that I mentioned before, because there's usually a fully covered alternative that's accessible through the plan. And sometimes it's just a matter of education or navigation to get you to a medication that's fully covered and that you don't have to pay out of pocket for. And then step 4, obviously, the drugs get dispensed and our plan would be billed directly. If I can go to the next slide, please. So the previous slides really talked a little bit about how you access the drug benefit. But one of the things we'd like to also just highlight is that the Plan W drug plan is a drug plan, but it also covers certain pharmacy services as well. One of the services that we'd like to kind of spotlight is a medication review. So FNHA has entered into a partnership with UBC's Pharmacist Clinic and have set up, very similar to Doctor of the Day, a virtual service whereby individuals can have a medication review to make sure that the drugs that they are taking are still suit the conditions that they're seeking treatment for, and that they're somewhat optimized, that you're not taking drugs that you don't need, and that the dosages are still relevant, et cetera, et cetera. It is still a fully covered service, so clients wouldn't have to pay anything. And this service can be referred through the Doctor of the Day program as well. So it's just a free service that clients are encouraged to use just to make sure that they're not taking drugs or medications that they no longer need. So again, just optimizing their drug treatment plan. And if we can go to the next slide, please. And just kind of in closing, while the health benefits program and the Doctor of the Day are both under FNHA, they are somewhat separate in some regards, but we are fairly well aligned. Health benefits does provide regular updates to the Doctor of the Day in terms of drug coverages and changes to drug coverages, and just highlighting the fact that physicians can request special authorities or even work with local pharmacists to ensure that clients are getting the treatments that they need. So those are the slides that I want to present. Again, went over the content at a fairly high level, but if there are specific questions, I'm happy to take any questions that you might have, but also encourage clients and providers to contact our health benefit assessor line at that 855 number that was shown a little bit earlier. And maybe at the end of the presentation, we can flash that back up again. But I'll leave it there. Maybe Dr. Alder, I'll hand it back over to you.
Yeah, thanks so much. We could probably move to the next slide. Yeah, so that's the number you can call to book an appointment. If you have any questions, you can email our the general email for Doctor of the Day, which is regularly monitored by our lead MOA, and can call other people in as needed to answer questions. And so I think that's it for our slides. And then we're happy to answer some questions. I know there's been a few, so.
Awesome. Well, thank you very much, everybody, for presenting those slides and taking some time to walk us through it. I really appreciate it. You're absolutely right, Dr. Aldred. There are a couple questions, so I'm just going to zoom through them as quickly as I can here. The first one comes from Mona, who says, we're starting a virtual program in the Kootenay boundary area and wanted to provide culturally safe care. Can you recommend a training program for our providers? And I think that links into a few other questions that people had around culturally safe care and how are we defining culturally safe care as it relates to the virtual Doctor of the Day service? So maybe if you could just walk us through kind of, what sort of training do you offer physicians who, are transitioning into this sort of work to make sure that that care is indeed culturally safe and the space is safe? Because it's a different animal, obviously, doing it virtually as opposed to in person. So I was just wondering if you could walk us through that.
Yeah, for sure. And so I think upfront, I just want to clarify a little bit around the terms. And so the terms that FNHA uses around cultural awareness and humility are terms that are provider or person focused, meaning that what we can do is we can develop our own cultural awareness, both of our own worldview, but also that of other people and their worldviews. And that helps us to with regular self-reflection, to be culturally humble, to know that we're not going to always get it right. We don't always know what we don't know. And it's important to continue our journey and to continue to learn. And so this helps us to be more respectful and to engage in a way where we can also learn from the people that we serve. Cultural safety can only really be defined by the people accessing care. And this is why it was really important that we have the patient surveys or client surveys that are sent out. With the Doctor of the Day program, we've had really good uptake, a little bit less uptake with our VSTEPS program, but that's because there's a bit longer waits likely, but we're hoping to work on that. But we've received quite a bit of feedback back through the surveys, as well as through our social media posts, and also through our complaints and compliments pathway, as well as just our general email inbox. And so we do try to respond very quickly and thank people for their feedback and how we can, continue to improve our services and ensure that they still continue to feel that the care that they're receiving is culturally safe. But yeah, so as far as saying like, what can we do to ensure our providers are culturally safe? Well, what we can do is make sure that we're asking the people accessing care. And so, and then work on that feedback to ensure that that's experience they're having. As far as like training opportunities, so there's a number, and we don't necessarily prescribe and say that this one is the gold standard that everybody has to do, because I think there's lots of value of different ones. And again, because this is a journey, that we want to move away from a ticky box approach where we say, do SANYAs or do the Vancouver Coastal Program or the UBC 23-24, and then you're done. You've ticked your box and you should be good to go. And so really to say that, we should be engaging with this material on a regular basis. And so we did do a provider survey where we asked people, and many of our providers have already come in doing quite a bit of training. And in addition, in our selection process, we asked people to write a letter to kind of describe why they would like to work with our program, why they would like to work with FNHA, and to kind of share with us a bit of, their lived experience. I'm sorry, my dog is also very excited. And so both their lived experience, if they're Indigenous and non-Indigenous, if they've worked with communities, if they have those connections, different things like that, so that we can, as a selection team, kind of have a process that's more in depth than just looking at somebody's CV, and that to kind of get an idea of the if they would be a good fit. So that's part of it. And then we do have regular provider meetings, and especially last spring, we did hold a number of sessions around, anti-Indigenous racism and cultural safety. And then there are FNHA courses as well that people can take, and many have. And many are taking the subsequent courses after like the first baseline. But if they haven't, if they haven't already taken those courses, then they are given a period of time where they can complete them. And so looking into the future, we really want to embed an ongoing practice of cultural safety and self-reflection. And right now, because there's such a need, I'm working with some of the other real-time virtual support leads to kind of think about, whether or not we want to develop a bit of a virtual hub so that we do have kind of a built-in system where we can come back to this over time, because it's really important that, cultural safety and humility training is really important, but it's one aspect. Same with looking at anti-racism, and in particular to this work, anti-Indigenous racism approaches, which kind of works alongside equity, diversity, inclusion principles. But all of them are slightly different, but really important. And even me, I keep taking courses, I keep learning more, reading books and different things. And I'm still surprised sometimes with some things that I learn about that help me be better in my role. And so, so really trying to move people past this idea that there's one course or one thing, but we really wanted to embed it throughout. So it's embedded in our selections. It's actually embedded in our contracts with our physicians, that, that these principles are important. And if there were a number of concerns, then we can actually, use the fact that they signed this contract to committing to being culturally safe or providing culturally safe care, to kind of enforce these principles. And so we've really tried to embed it in everything we do, but also try to model it ourselves, if that makes sense. Sorry, that was a very long-winded answer, but hopefully I was able to address some of the things that had emerged.
No, I think you got to it, Dr. Alder. Thank you. I want to just take a second to invite Dr. Louis, Atma, if you had anything you wanted to add to that answer, and it was pretty thorough, but before we move on here.
I'll just add one thing quickly. Terry had alluded to the monthly meetings that we have as a group, and I think early on there was lots of change, there was lots of learning, there was lots of reflection and feedback, and we were always trying to adjust to, make these tweaks so that it worked for us, but also the feedback that we heard. So we were meeting a bit more frequently than that, but really started to incorporate a lot of those shared teachings, the opportunities to learn and just converse about, how we're providing safe care, each other's reflections. But one of the things that really became quite evident and powerful for me was through FNHA, we have a few knowledge keepers. And one of them, Sequoia Ann Wannock, who she's one of our knowledge keeper and elder, if you will, who's come and really helped lead our group of providers. So, comes with an opening remarks, opening prayer, sits throughout our meetings and listens in to our work and what we face, and has really been, a pillar of sort of guiding light for our group. Really grounds us. Is just, I think we know in our communities when we have our matriarchs and our leaders and those who really help, share and communicate and sort of refocus us. That's been something that's really been really evident with her presence at our meetings. And I think everybody's really enjoyed that. And when I think of as physicians, when we're going through this journey, engaging in your local communities or your local regions and areas, trying to build those relationships. And I always think it's, a level of reciprocity. So, what is it that we're sort of obtaining here, but what else can we give back to the community and others? And I think it's a really beautiful relationship. But having Sequoia there has been something that I've really valued. And I think the rest of the providers have really enjoyed that.
Awesome. Atma, did you have something there?
No, just gonna say I have nothing to say. Thank you. It was covered quite well by the other two respondents. Thanks.
Awesome. Well, thanks very much, Dr. Louis. We're at 3:55 now, so I might be able to sneak in one more question here. My question is kind of a little bit around the future of the virtual Doctor of the Day service. A few individuals had kind of thrown some questions around about kind of what's next, what's on the horizon for the program. Is there talk about introducing shared EMR, asynchronous text communication? Is there anything that you could share with us generally about kind of what's on the horizon for this program? I think particularly in the context of, the COVID-19 crisis coming to an end, hopefully soon, crossing our fingers, we're all able to come into clinics and to see each other face to face again. And obviously that's going to impact a lot of these services in some way or another. Could you kind of provide any sort of guidance as to what that might look like in the future?
Yeah, for sure. And so Aaron Tedesco was really instrumental in standing up the virtual pathways and has a new role as a director of EHealth and Transformation, I believe. And so with that, they're actually looking at, because all of our virtual pathways and all of the care providers that work with them are all on the same instance of EMR. And so we do have the ability to really share care quite easily. And from that, kind of also looking at the need around, what a provincial First Nations EMR would look like. And so although early stages, I think thinking of piloting in the North, which have already agreed as a group of communities that they wanted to have a shared EMR, that they are looking at that process and how it can be interconnected, and certainly looking at how we can make virtual care safer and ensure that sensitive or private information is kept private is really important. So are looking at like secure texting platforms and different things, because sometimes it can be a challenge if like documents need to be signed or letters need to be sent and things like that. It's possible, but can be a bit more streamlined. And so certainly looking at how we can enhance those services. Many of our First Nations communities, their health centers that they open up are telehealth enabled. And so looking at how we connect with those services as they open will be really important. And then the other thing about is around the First Nations primary care initiatives planning. So FNHA is helping to stand up 15 of these primary care homes across BC, 3 in each region. As a start, and really wanting to connect in our virtual services with those on the ground supports, so that so when that people need to be seen in person, they can be, but we can also be a resource and support for providers on the ground.
Yeah, and I would echo that. I think through our service, there's the virtual pathway that we have, at the Doctor of the Day or the substance use and psychiatry. But we also know we have the ability to tap into our Mabel service, the maternity group who have, that specialty there. So we have a young mother, either they're in pregnancy or they've just had a newborn, they've got questions, we're able to sort of tap into that expertise right away. Same thing like dermatology, rheumatology. We have all these different services that are up online, and we can sort of connect in with them right away. So, maintaining those relationships and establishing them moving forward, I think is really good. We talked a little bit about, the primary care-led projects. When we think of healthcare, we still need those on-the-ground services, somebody to do an examination. And I know there was a couple of questions around, the persons with disability forms and others. There are some limitations that we have. Some of those forms do require physical examinations to take place. And if we can't do that, we do a disservice to the community member trying to haphazardly, do these forms that are probably going to fail. So we've taken a sort of a broad stance, I guess, where there's a few things that the service that we offer doesn't do. And one of them might be forms. We have policy around opioid use and the prescriptions of, some of those stronger medications. We've done some things there. So, being able to connect people with services on the ground to complement, what we can do virtually, I think is something that we're looking to sort out as we move forward into the future.
Awesome. Well, thanks very much, everybody, for your time here today. I know we actually came right to 4 o'clock, so awesome timing. Just as we transition here, I'm just going to provide a little plug here for upcoming learning circles. Sorry. In particular, you'll see on your screen now the virtual Doctor of the Day supporting the patient journey. That's our next session. That'll be in June 30th, so about a month from now, and that'll be at our usual time at 10 a.m. And then beyond that, we have a great series coming up focused around Indigenous health and wellness and sport, and that's produced in partnership with the FNHA and iSpark and a few other organizations. So please make sure that you check those out. We're really looking forward to the month of June in terms of our programming. Dr. Aldred, Dr. Louie, Atma, thank you all so much for your time here today. I feel like, we covered a lot of ground in an hour, so I'm very grateful. And thanks everybody that attended and submitted questions. We hope that this session was informative and helpful to you. Yeah, so until next time, I guess I'll say goodbye from now. Take care, everybody. See ya.
Bye. Thanks for having us. Bye-bye.